So my name is Ria Patel. I'm a UCL medical student and I just completed an IBSc in Paediatrics and Child Health. So the work that I presented during the RCPCH plenary abstract slot today was looking at transition and developmentally appropriate healthcare with the North Thames Paediatric Network. So we aimed to identify and assess how transition and developmentally appropriate healthcare are currently being delivered across the network in order to reduce inconsistencies and improve care for young people. When I'm talking about transition, I'm referring to the planning and preparing for young people to move from paediatric to adult services, and developmentally appropriate healthcare is the requirement of catering to young people's stage of biopsychosocial development as opposed to just their chronological age. So these are the two concepts we were looking at. We disseminated an electronic survey to clinical and specialty leads across the network. Some of our key findings are that only 54% of our respondents report regularly seeing young people alone and informing them of their right to confidentiality. Only 58% report adjusting the approach to care as young people develop, one of the key domains of developmentally appropriate healthcare. With regards to transition, around 76% of our respondents had access to a transition service. However, 31% indicated there was currently a gap in service provision, with those aged 16 to 18 being most commonly affected by this gap. Overall, what we found is there is currently inequitable access to resources and support for healthcare professionals to provide transition and DAH to their patients. There's variation in how this care is currently being delivered, and there is an alarming gap between services, particularly impacting those aged 16 to 18. Some of the key take-home messages we shared at the RCPCH conference today were in identifying a transition lead, engaging with trust management, seeing young people alone and adjusting the approach to care as they develop, and collaborating with adult services through a joint vision to improve care for young people.